Record. Hi, y'all. I am here with Jess Venables. She is an ICU nurse working in Ottawa, Canada, and we met via our wonderful mutual friend, the amazing Sophie Brown. And Jess, welcome.
Thank you. Thank you.
Thank you so much for everything you're doing right now, and thank you so much for your willingness to talk to me and answer questions. The first thing I'm going to ask is just when and why did you become a nurse, and what is the day in your work life typically like?
So I didn't really know what I wanted to do through most of high school, but I started working at a summer camp for kids with disabilities, like in my community-ish. And it was overnight, and they had 5 nurses there full time. So I got to kind of chat with them and was really inspired by that. And so next thing I know, I was a nurse.
Right.
Yeah.
Just like
so
that.
I can't complain. It's worked out well. I haven't looked back since. And so typical day for me, I work in the intensive care unit here. So we do shift work. So some people are often surprised, but the hospital doesn't close. We're always there. My parents still don't get it. But yeah, so our shifts, we do 12 hours. So we start 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. And typically like about 4 shifts a week.
Right.
Average.
Right. So, and were you doing these same shifts before COVID-19 happened and everything? Was that, yeah. So that's been similar. And in the ICU, I would imagine anything can happen, right? So you might have.
Yeah, so for the most part, we are one-on-one nursing. So like one nurse to one patient, sometimes 2 to 1, but mostly 1 to 1, especially like because a lot of our patients will be on life support. So they'll be on those like ventilator breathing machines everyone's been hearing so much about.
Yes, yeah. So. Okay, right. So so when you do the 12 hours, you're pretty much with the same patient the entire time. Right.
Yeah.
Right.
Yeah.
I think I briefly confused ICU with the emergency room, which I know are 2 separate things. So actually that would make sense, right? So it's 12 hours with a person who is unwell, but you're there with constant support, kind of.
Yeah. So in ICU, the patients are like admitted to hospital. They're not doing well. They're typically with us for anywhere for a week to a couple months sometimes.
Right. Cool. Because I'm from the States and I live in Australia, I'm guessing a lot of people who actually watch this probably won't know a huge amount about the Canadian healthcare system, which although I know Americans talk about it a lot and are intrigued by it, but without getting too complicated, could you just give me in a nutshell, explain how it works, if possible?
Yeah, so our healthcare system is much more similar to the Australian healthcare system than the American. So we're universal healthcare. So it's funded by our federal government, run by each province individually. But what that means for me and for most people is we get a healthcare card, and if you need to go into hospital, you just present that card, and all of the care provided while you're in hospital is covered by the government. So medications you need, tests, MRIs, treatments, anything like that is all covered.
Right. And you don't have, you don't get a bill in the mail later or anything like that. And you don't have to sign up for it or anything like that. It just kind of comes with your, I don't know, citizenship, I guess.
As you're like a resident, if you're living here, you're covered under our healthcare system. So it's pretty, I mean, nothing is perfect. No system is perfect by any means, but it's pretty awesome. And it's pretty good to know that you get sick, it doesn't matter. You get the care that you need, and then you get to get well and go home, hopefully.
Right. Now, the Australian, I don't want to talk too much about this, but the Australian does have private healthcare option that some people can have. Does that even exist at all in Canada?
Not really.
Really? Okay.
No, for the most part, it's all, so there's a big heated debate whether we should have a private portion for the people who can pay or not.
Right.
But for the most part, everything is public.
Okay,
I think there's a few places that will do things like MRIs and stuff and shorter wait list if you're willing to pay for it.
Okay.
But all of our hospitals and everything like that is all public.
So there's not a private healthcare hospital versus a public one or anything like that. I think we do have that here in Australia. So you don't have to tell me which hospital you work at, but could you tell me what it's like? Is it big or is it small since COVID-19 has hit North America? Have there been many cases?
So I work at one of the bigger hospitals in the city. So I live in Ottawa, which is actually a pretty small city in Canada, but it's our capital. Yay!
Ah, that's why I know it. Sounds, I imagine, a big city. Okay. Typical American.
So it isn't compared to like Toronto, Vancouver. We're smaller. So the unit that I work on in the ICU, it's a 32-bed ICU. We're not often full to our 32 beds, and with the like pandemic planning for COVID, they got very creative and we're like, okay, we can expand up to 90 beds. We can have up to 90 patients. But thank goodness Ottawa and like Canada in general has done amazing at keeping the cases down. So we haven't seen a huge influx in our numbers.
Okay.
Typically, I would say we have maybe 5 COVID patients on the unit at any given time.
Right. Right. So you do have them,
very manageable.
Right, but it's nothing like where we're hearing of other places where it's the beds are flooded. So right. So do you think at this stage you didn't even the extra planning for the extra ICU beds has been unnecessary so far?
Yeah.
That's great.
We've been super lucky.
Right. Right. And which province is Ottawa? I should know. Is it Ontario? All right. Yeah. And is that and is Ontario as well? Because I read that as of now there have been over 4,000 deaths and nearly, probably now since I've written the questions, over 65,000 cases. But Ontario is doing pretty good.
I think Canada as a whole is doing pretty well. Unfortunately, now where we're seeing a lot of cases is in our like long-term care homes, retirement homes. Which is super unfortunate.
It is sad. There's and the scary thing is, I say this now and I just hope that when we look back and watch it in a month's time, it's even better, because the thing that I find intimidating about it all is that there are spikes sometimes. So I hope that it continues to kind of flatten. When I want to ask a little bit more of your personal perspective, just as someone who works with patients. When you heard, what did you think when you heard about the outbreak happening in China? Did it ever cross your mind that you would have patients in your own hospital with it?
Honestly, no. So prior to COVID, like ages ago, I think, I'd watched podcasts and documentaries about various pandemics. And it's in my mind, I was always like, I feel like it's an inevitability with just the way society is and how much travel we all do. But when I heard about it in China, it was really tough to be hearing about, but I kind of probably very naively thought we wouldn't see it in Ottawa. I thought, maybe it'll spread to some of the bigger cities, maybe even Toronto, which is in Canada. But I didn't think that it would make it to us here.
Right. When did it, this was a surprise question, but when was it that you started actually seeing patients arrive? Do you remember?
So we started shutting things down and sort of social isolating second week of March, maybe.
Okay, right.
And I would say it was probably another week or two before we started seeing patients make it to ICU.
Right. And could you talk to me a little bit about your observations in the medical field? I've talked to a few different nurses. One nurse, Morag from Scotland, told me that she's actually tested patients. The nurse from Nashville was telling me about the masks that they had to wear and the tests that they had to use. But could you, talk to me about what have you noticed is in the patients, in the experience, I guess, in the medical field during this pandemic? Has it been greatly different than your regular shift that you used to work?
So parts of it are very much the same, and definitely parts are different. So what's been tough for us as nurses is just because this is a new disease and like research is evolving, the hospital's just coming up with new policies and procedures all the time, which is super important and great. Like it's mostly to protect us and to protect patients, but it's just tough because everything is changing all the time. So, things you do typically, you come in and they're like, okay, no, now we're going to do it this way or that way. And like I said, a lot of the time it's to protect us and the patients. So it's good. It's just tough because every day is different and things are changing all the time. The other thing that's been a big change in our practice is we're not having visitors in the hospital right now.
Yeah. Yeah.
So that sucks.
Yeah.
For the patients, just, seeing them struggling and not being able to have families at their bedside.
Yeah. So have you had the situation, and I guess some of your colleagues, where you've been kind of a catalyst? You've been able to connect them with their family on Zoom or Skype or Messenger or something like that?
Yeah. So we have iPads now around the unit. So we can Skype and FaceTime and Zoom family members.
Yeah.
So that's been really helpful. It's tough for us because I'm sort of standing there like holding the iPad through these like amazingly personal, emotional moments. And I'm just like, oh, hi.
Right.
So that's kind of like tough. Whereas a lot of the time before we let all the families in, we'd kind of close the curtains and, give them some privacy. And selfishly, that kind of insulates us a little bit from everything.
Yeah. So that's kind of like just, that's not even like physically health related. That is just, you are kind of in their last moments. Sometimes, hopefully not, but it could be that, I guess. So, right.
Well, and especially like, not only do we not have visitors, but often when we're seeing patients really sick with COVID, they have loved ones at home who also are infected.
Right.
So, even if they could, because obviously in very extenuating circumstances, with appropriate protective equipment, we'll let a loved one come in, but we can't let them come in if they
Of course.
So,
right.
Yeah.
Oh, yeah. That's tough. That's really tough. You said you have about 5 patients so far. You've only had about 5 patients with COVID in the hospital at any one time. Are they typically on ventilators?
So it's 5 like in ICU. I think right now, like as per our latest email, there's about 20 in the hospital, entirety in the hospital.
Sorry, in the entire hospital. Okay.
Yeah.
Right.
And with COVID, we're actually trying not to ventilate them, put them on those mechanical ventilators. And it's not that we have a shortage, because we actually have a bunch now, which is fantastic.
Great.
But it's just, once they're on the mechanical ventilator, it's hard to get them off of it. Like they lose a lot of strength. It's necessary sometimes, but we're trying not to do it. But what that means is these poor patients, like COVID patients, are just really sick. These poor patients, it sucks. Don't get COVID. Everyone stay safe.
It's a real disease, and I think it's more serious than people understand, just from stuff I'm reading, and that there's just a lot of unknown. So so they're just requiring such high amounts of oxygen. So they're having these big masks on their face that often are also giving them a little bit of pressure just to make it easier to breathe. But they'll be on those for days at a time. And sometimes even just taking them off for a minute or two, they really tank their oxygen. We've seen patients lose consciousness because their oxygen levels go so low so quickly. So it's tough because these patients are stuck on these big masks, giving them all this oxygen for days at a time. We don't have family members. So it's tough for us to watch too, because as nurses and healthcare professionals, we love to do things. And other than giving them medications and fluids and stuff, it's a bit of a waiting game. Right. Oh my gosh.
So there's only so much we can do for them, hold their hand, play some music, FaceTime family, but we're kind of just
So is it almost like if someone it's almost like it's a little bit of a crutch when someone goes on a ventilator, like it encourages them to not use their own lungs, kind of?
Exactly. So they lose a lot of muscle strength when they go onto the ventilator. Well, which then is hard.
Then it's hard for them to, I guess, build it back up. So it's like I was reading that it's not ideal when people go on ventilators at all, and it's almost like by that, I think I saw a statistic somewhere, I'll check this before I publish it, that 50% of people who go on ventilators don't go back off them. So I can see why it's just a challenging thing. But this is a surprise question, so you don't have to answer. Do you find any younger patients at all that you see in the ICU with COVID, or is it more of a 70s, 80s? kind of?
So we have seen some younger patients. Most of the patients are older, but what's surprising is we have seen quite a few patients who, are sort of like 50s, 60s, but like we're very, very healthy, running, playing this might sound very Canadian, playing hockey multiple times a week, which requires like quite a bit of exertion, like didn't have any other medical history.
Right.
So that I think was slightly more surprising. That. And it is affecting young people. Just because I haven't personally seen it doesn't mean that's not the case. But
no, I saw in New York they're talking about some like kids at the moment that have been affected by it, and it's just like, keep learning more and more terrible surprises. On a more positive note, have you seen a lot of recoveries?
I haven't.
Oh, really? Okay.
So we have had a few. Had a few.
Okay, good.
So that being, like I said, we haven't seen a ton of patients. So this is very much my personal experience. It's not necessarily generalized.
This is about your personal experience. That's why I wanted to talk to you. So we can clarify that as well. Yeah.
And so just because I haven't seen recoveries doesn't mean that everybody has passed away. Like we still have lots of patients on the unit that we're still treating.
Right.
Because it tends to take people a while to get better. And we have had a few patients who have recovered and gone home. So
well, it must be tough at the moment. And what about you and the rest of your family? Actually, I haven't asked you about what your family situation is, but do you have a family? Are you living by yourself? And do you have a protocol with like, I guess, first of all, like when you leave the hospital and the hygienic side of things, and also just how you're dealing with this on a more personal level?
So the hospital is providing us, we used to wear our own scrubs, but now the hospital is providing us scrubs. So like I wear my regular clothes to work, get changed at work my shift. And then there is showers at work. I often will change, come home, and then I have a laundry bag in the bathroom, just go straight into the bathroom, shower. And I'm lucky. I'm living with my boyfriend, and he is also a nurse working in ICU.
Right. Really? Okay.
So we don't really have to be careful around each other because we're both working in it all the time.
Right. Is he at the same hospital?
Yeah.
All right. Oh boy. It sounds in some ways it's good, but I'm sure you guys have, a lot of shared experiences.
Yes, it's good in that point that he always gets it.
Right. Yeah.
And like I said, it's great. Like one of my friends, her fiance is still working. Like he doesn't work in the hospital, but still has to work. And so she kicked him out of the house, and he's living with his mom right now because he's like, I don't want to get you sick.
Yeah.
So I'm grateful that I don't have to do that.
Yeah.
We are distancing ourselves from our family members just because we work with COVID patients all the time. Like the risk of us coming into contact is higher than the general public, I'm sure. And so many people are transmitting it, like can be asymptomatic and are transmitting it. So we have been distancing ourselves from our families. So, but luckily we can do like FaceTimes and everything like that. And we've done a few drive-bys and waves. So
and has this is another surprise question. Has anybody, any of the staff there, have they tested positive for it since?
At the very beginning of COVID, we had 2 healthcare workers test positive. That being said, it's more than likely that they got it from somebody or like a coworker. Like they didn't get it from a patient in the hospital. They probably, this was sort of very early on before social distancing and things were shutting down. So, they could have gotten it anywhere.
Okay. All right. So overall,
luckily since then.
Good. And then also, feel free not to talk about this, but it sounded like things were going good so far. You guys have plenty of ventilators. You have plenty of PPE and stuff like that. You're all, you guys are.
Yeah, so like there's definitely, we're mindful of our PPE. I'm not worried about shortages per se. Our hospital's been very transparent. So they post numbers every day about how much we're using per day, how much we have remaining. And now they've been good about sourcing PPE from other sources rather than our typical places that we're not able to get stuff from. So I'm not necessarily worried about a shortage. We're definitely just very mindful of, clustering our care and trying to use it as appropriately as we can.
Right. So you said that you might not be getting it from the sources that you usually.
Yeah, they're like getting creative on different companies are now like producing masks.
Is that just because of the supply chain and stuff like that? It's just there's
Yeah, and I think we're using so much more than we were before. Whereas, I mean, a lot of this PPE is stuff we were using before, but just not as much of it.
Yeah. Just the caution level has gone up, I guess, just with everything.
Well, and now like they're using masks, like we're wearing masks all day, every day through the hospital, as are all of the other workers. It's just like we're using more, I think, than we typically would.
Yeah. Were you happy? You talked about just at the beginning, so one of your colleagues got it not because of the hospital, just because of social distancing. What are your thoughts on how the government and the citizens have reacted to COVID-19?
So as we've been talking about the fact that, we were preparing to expand our intensive care unit to 90 beds from 30 and we haven't had to, I think is really testament to the fact that whatever we're doing is working. Obviously, no one wants to shut things down and no one wants to not, go out for drinks with their friends. And, one thing that hit me is the ski hills all closed early here. So, but now that I've seen the effects of COVID on patients, and I really can understand and appreciate why we did it. And like selfishly, it's also made my life easier not to have to be caring for.
That's not, I don't think that's selfish.
So
you're glad.
Yeah.
I mean, go ahead. Please go ahead.
No, it's just tough because obviously I don't want things to close down and it's really negatively affecting lots of people and our economy.
And you're quite young, like you're at the time of your life, I feel like, where you should be having lots of fun and
we're just getting more creative with ways to have fun.
Yeah. And I heard Soph mentioned to me that people have been really kind towards frontline workers and baked goods and stuff like that. And
yeah, the community's been amazing. We're getting like food delivered to work all the time. And my partner actually just went to pick up our dinner from a local restaurant that's giving away today meals free to nurses.
That's
so we don't have to cook, which is amazing.
That's great.
So yeah, they've been really supportive.
Yeah. And what is in Ontario? And forgive me if you don't know all the specifics, but I know that in the U.S. and in Australia, each state has different guidelines for when they're opening. So the Northern Territory had very few cases in Australia, so they were able to relax restrictions much sooner than New South Wales and Victoria. What have been, what was the lockdown kind of like in Canada and specifically in Ontario?
Yeah, so it's each province that has had various guidelines, and even within the provinces, various cities have done different things depending on how hard they were hit. So for us here in Ottawa, just this week, we're slowly starting to open up. And what that means is any stores that have like a storefront on a street, they're able to open for like curbside pickup. So you can call or go online and order what you want and go and pick it up. They're allowing more like hardware stores. We're going into spring and summer here. So garden stores, landscaping, things like that to start opening up with social distancing guidelines in place.
Right. Interesting. It sounds like it might have been a little bit more strict. So the restaurants were pretty much complete, like not even takeaway for a while. Is that?
So some restaurants, so the way we had it is only essential stores could be open.
Right.
So not even for takeaway or anything like that. Right. Stores were closed unless you were, a grocery store, a pharmacy, where they were allowed to be open.
Okay.
And restaurants were allowed to do takeaway and delivery, but they're now expanding the amount of places that can do takeaway and delivery and letting clothing stores and things like that.
Right.
So this is our phase one of opening things up. And they had closed down all of our parks and stuff. So you were able to just walk through the parks, but now they're opening them up for you can go and you can have a picnic in the park as long as you're social distancing.
Mm-hmm. And do you feel like people respected all the rules when things shut down for the most part? Or like, I know that the US has had quite a few reactions, and in Australia, I think I don't think we've had like armed protests in Australia, but there have been people who've been frustrated. Do you think that,
so there's definitely been, I think before this really happened, when things were first sort of suggested, a lot of people weren't respecting them. And then as we've gone on, I think people have become a lot more respectful. And I think people are kind of scared. So people are being really careful.
Yeah.
So we're lucky. There was a protest
all right.
On our Parliament Hill that 20 people showed up to.
All right.
So for the most part, people are fine with it.
Right. And I guess I'm just curious, kind of with everything that you're doing, and it sounds like just from some of the stories you told me, it is a bit challenging from your personal, professional outlook, and your partner's, I guess, if he's a nurse as well. What are your thoughts of how the world might be different after this? Do you think there'll be any silver linings?
Yeah, I definitely think going forward, it's going to be different for a while. One of the things that I'd like to see come out of this is, like we were talking about earlier, all of our like retirement home, long-term care homes, they've just been devastated by this. And I think they've had long-standing issues with staffing and funding and lack of support. And so I hate that this had to happen, but hopefully it's going to shine a light on that, and we'll be able to support our elderly population better. And from a personal perspective, it's kind of, when we first shut down, everyone was like, oh my gosh, I can't go to the hairdresser, I can't get my nails done. But now to me, like, I just want to give my parents a hug, and go for like a hike with my friends or drinks with my friends. So I'm really hoping that it reminds everybody what's important. Like, I don't really care that I can't go to the mall, but like, just kind of grounds us a little bit and brings us back to the essentials.
Aww, that is so beautiful. I think I agree, and I think you're right. And is there anything else? I've taken quite a bit of your time, Jess. So, is there anything else you want to mention? Is there anything that I kind of glossed over that you want to talk about?
There's nothing I can think of off the top of my head.
Okay. All right. Thank you to you and your partner and all your colleagues for everything that you're doing. You guys didn't really ask to be put in this situation, so everybody appreciates it. And I wish I could do more to say thank you, but
no, you guys are doing awesome. We appreciate it. So.
Oh, okay.